greetings from Gaza. I'm at the WHO office in Deir Bala. So I want to update actually on two key areas. One, an update on the polio campaign, the polio campaign, which is set to begin on the 1st of September. And then I want to give you a bit of a general update on health. So first of all, on polio, a 2-round polio vaccination campaign is set to begin on 1st of September in the Gaza Strip. And during each round of the campaign, the Palestinian Ministry of Health, in collaboration with the World Health Organization, UNICEF, UNRWA, and partners, will provide 2 drops of novel oral polio vaccine type 2, NOPV2, as we call it, to more than 640,000 children under 10 years of age. So it's the Ministry of Health, UNRWA, and UNICEF and partners, together with WHO, we are ready to deliver the campaign, and preparations are being finalized, ongoing as we speak, etc. It's Friday, but actually just under me, the technical committee, WHO, UNICEF, UNRWA, partners, Ministry of Health, they're actually finalizing preparations. So 1.26 million doses of the vaccines and 500 vaccine carriers have already been delivered to Gaza, cold chain equipment, etc. 400,000 additional vaccine doses will arrive in Gaza soon. Over 2,180 health workers and community outreach workers have been trained to provide vaccination and inform the communities about the campaign. So this is a complex exercise, and at least 90% vaccination coverage during each round. There will be 2 rounds split by 4 weeks. During each round of the campaign is needed to stop the outbreak, to stop the circulation of polio within Gaza, but also to prevent international spread of polio. So we welcome very much welcome the preliminary commitment to this, what we call area-specific humanitarian pauses during the campaign. And we call on all parties to pause the fighting, to allow children, the families, to safely access health facilities and community outreach workers to get the children who cannot access health facilities for polio vaccination. We want to really emphasize this again and again. Without humanitarian pauses, the campaign delivery, which is already being implemented under incredibly complex and challenged circumstances, will not be possible. So in response to the commitment of this area-specific humanitarian pauses, it has been agreed that the campaign will be delivered in a phased approach over 3 days each, starting with central Gaza, followed by South Gaza, followed by North Gaza. Because of the insecurity, damaged road infrastructure, and constant population displacement, and conducting the campaign for just 3 days in each area is unlikely, very unlikely, to be sufficient to achieve the adequate vaccination coverage. So vaccination coverage will be monitored. That's always happening with any polio campaign, monitored, analyzed every day, and adjustments will be made throughout the campaign. The vaccination will be extended by 1 day whenever necessary. So over 2,180 health workers and community outreach workers are ready and will support the campaign. Campaign will be delivered through 392 fixed points and almost 300 mobile teams. This is a massive operation. The security, of course, is paramount, and we urge all parties to ensure that protection as well of them and of course of the families, as well as the health facilities and children. Finally, I mean, on the polio thing, we will raise it every time, but it says, and I don't want to sound as a broken record, but of course we reiterate our call for a ceasefire to enable the rebuilding of the health system, strengthening of the routine immunization. And that brings me a little bit to the overall health situation. And there we unfortunately continue to be deeply concerned. We talk about hospitals functionality very often. And currently 17 out of the 36 hospitals are partially functional. Only 58 of the 132 primary healthcare centers are partly functional. In addition, there's five field hospitals which are partly functional and 4 fully. Absolutely insufficient. And a specific area where I want to mention, when we talked about that for a number of times, about fuel. Very simple, and it's really, I think it shows the complexities that we still have to talk about that in the 11th month of this crisis. So in the last 2 weeks, out of 6 missions planned by WHO to the north, only to bring fuel and medical supplies, only 2 were approved to deliver the fuels and medical supplies. The day before yesterday, after incredibly lengthy, unnecessary lengthy mission, WHO reached Indonesian hospital with fuel, and from there fuel was supplied to Kamalan 1. And just to share some example what this means. So as of Tuesday, a lot of hospitals in the north, they face serious fuel shortages, which will result in cancellation of their maternity services, the 15 daily surgeries, including C-sections, etc. They have hospitalized patients, limiting their lab, X-ray sterilization, etc. will all not be possible. Al Hilu Hospital, there's also a number of hemodialysis patients, etc. The same thing, and of course, fuel is needed. The same applies for Al Hilu International Hospital. They will have to cancel their general surgical operations, etc. Issues with other hospitals in the neighborhood, we've seen a lot of evacuation orders, which is affecting all hospitals close by. If it is Al-Aqsa, it's relatively close by here. We see the hospital operates on 30% of the staff capacity and to take care of over 100 patients. European Gaza Hospital, which was 50 days out of services, just started again with partial services, restored emergency and surgical and inpatient. Nasser Hospital, also relatively close to the so-called evacuation zone. There, with Nasser, we also focusing on non-communicable diseases. WHO managed to reach the hospital with medication for cancer patients, hemodialysis, disposables, and medications. And we make an assessment for other supplies, which is needed. Last point I want to raise, and that's of course related to diseases overall. And we've seen, and it is difficult, this whole public health intelligence, of course, has been hampered in a big way. And we've seen over time, and again, this is underreported, more than 1 million cases of acute respiratory infections, over 600,000 cases of diarrheal diseases, which is a 25-fold what it normally is. Over 105,000 cases of scabies and 70,000 skin diseases, and over 105,000 what we call acute jaundice syndrome, which is actually hepatitis A. All of this, of course, a lot of this is of course related to the absolutely, I would say, horrible water and sanitation conditions throughout Gaza, and specifically in all these makeshift shelters, which you can see all the way from specifically in the south, but everywhere, also in the north, specifically from Deir Bala, Khan Yunis, and all the way to Mawassi. I want to leave it here. Over to you.